ambulance service. Is the patient breathing?
She's breathing, but she's just staring off in space. She's an 8-week-old baby. She's struggling to breathe, and she's bleeding around her lip.
I'm concerned she's got a blood clot in her lower leg. She's 102.
Starts in the morning, eh? I know.
We're on board with the paramedics of West Midlands Ambulance Service.
This job changes every day.
Can we get fire or police, somebody with bolt cutters?
Painful even when I'm pressing here.
Saving lives and making a difference every day.
You say the patient's been stabbed?
In a medical emergency,
You all right?
6 million people rely on them.
You can go to people giving birth, then in their most traumatic time of their life.
You could be having a bleed on your brain.
OK, mate, move in.
Filming simultaneously with 7 paramedic crews.
It's got loads of things going on.
Take steady breath for me.
Capturing life on the front line.
There's no price you can put on saving somebody's life.
Morning.
Morning, Bab.
Did you enjoy pizza?
It wasn't too bad. I mean, could have had it a bit earlier than I actually planned.
Yeah, early, yeah. Mine was a bit bad.
Yeah, because you can't cook, mate.
It might look like the middle of the night, but it's 6:30 a.m. The start of another day shift for the paramedics of West Midlands Ambulance Service.
Well, I find out shift of the week.
Yeah, I know. Well, I'm on my holidays, aren't I?
You're very lucky. I'm not. I'm not.
You're jealous, aren't you?
As they take to the road, thoughts turn to how the other half live.
If you could be any member of the royal family, who would you be?
Oh, well, would that be Prince Harry? Because he's just full of drama.
First choice would be the dog.
The corgis.
The corgis. Because, you know, they've got such an easy life. Lots of food.
Yeah.
Lots of belly rubs.
Yeah.
And then they sleep all day. I mean, what's better than that, really?
When we were in a house and someone asks us, "Oh, are you two married?" Remember when everyone used to ask us that?
Everyone without fail would always ask us if we were married.
Gosh, you'd be so lucky to marry a woman like me.
Yeah, if you're not my type. Patients think we're married all the time, don't they?
I know, I literally have no idea where they get it from.
I think it's just because we're so similar and we get on really well.
Similar ages as well.
Yeah.
But I don't see it myself.
No, absolutely not. I wouldn't marry you even if I was paid to.
You wouldn't have to be paid, you'd pay to marry me.
Is that what helps you sleep at night? OK.
Is this call for you or somebody else today?
It's for me. I was having pains going down my throat and just into the middle of my stomach, and it's hurting an awful lot.
No, bye.
Okay. 60-year-old male, pain going down throat and into his stomach. Pain is a deathly colour, and that's pretty much all we've got now.
OK, that's lovely, thank you. We'll go over and have a look.
Thank you very much.
There could be lots of things causing the pain. I mean, could just have a sore throat and be a bit ill. Or it could be something as sinister as he's having an MI.
Potentially. Any sort of chest pain can be a heart attack, and obviously that can be fatal. So it was really important that we got there as quick as possible.
I feel very in the dark about this one. Hello, sweet. I'm James, this is Chloe. How are you feeling?
Last week, for some reason, when I was having something to eat or drink, it was got sharp pain come here.
OK.
But it got major here.
Have you got pain in your chest at the moment?
I've got
as
pain
well?
here.
Oh, OK. Has it just been constant since last week? Oh, bless you.
For the past week, 60-year-old John has suffered with pain in his throat and chest. Today, when that pain got worse, he called for help.
I haven't ate now since I've had 2 meals in 5 days.
Okay.
I think it's because I had nothing to eat. I'm
Bit
starting to get dizzy.
Bit, okay.
Yeah.
All right. And what time did that start? Is it the last couple of days?
The last couple of days, yeah.
Okay.
And I've been sweating an awful lot.
Okay. Other than moving from your throat down to your chest, does that pain move anywhere else?
No.
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 Just in the middle of your chest?
Yeah, here.
Okay. All right. And what's the pain feel like?
It's like a sharp pain.
Sharp pain.
Yeah.
Okay.
I had a heart attack in 2010 and I suffer with chronic heart disease, I say.
Okay.
Yeah, and I had a stent fitted.
A stent.
Yeah.
Okay. All right.
It definitely makes us more worried when someone has had a heart attack previously and they are now presenting with more chest pain. The dizziness, the sharp central chest pain, the sweatiness, they're all massive red flags for a heart attack.
Might I like to pop some more stickers on your chest, bud? Do a 12-lead ECG. You had one before.
I have,
yeah.
With extensive history of cardiac issues, James and Chloe carry out an ECG. This will check the electrical activity in John's heart.
One more. There you go, pop your top down now.
Thank you.
How old are you, mate?
60.
60 years young.
Ah.
Right, stay nice and still. No moving or talking for about 30 seconds, okay?
When did you say the heart attack was, bud?
2010.
Can you remember what they said was wrong with your ECG after it? Did they say it was a right bundle?
Yeah.
John has a right bundle branch block. This is where the electrical signals in the heart stop working properly, leading to an irregular heartbeat.
With right bundle branch blocks, they're quite serious because it can put John at a higher risk of having complications with his heart. In worst case scenario, it could lead to cardiac arrest.
The King, like King Charles, he's 75. Do you really want to be working at 75?
Oh, the Queen worked until she was 90.
90 odd,
yeah.
95, 96.
I don't think I can physically understand a time when I've been near to retirement or retiring. Just, nah, I don't think I can even think about it.
And you know what? I can remember having that exact same feeling myself, of being sort of in my 20s thinking, I'm just going to be working forever, I am. And now I'm 3 years off being able to retire. I can't comprehend that at all. That feels so strange. No, I don't want to be working till my 70s.
No, don't go retiring on me.
Yeah, I would.
Ambulance services, patient breathing.
They are, yes. It's my mother, she's 92. I've just had a phone call from her this morning. She feels dizzy, she's struggled to get out of bed. She's had a pacemaker fitted. I'm racing to get out to her.
We are going to a 92-year-old female, and that's all I've got. Yeah.
999.
This could be anything. When we get a job where it just gives us the age, so 92-year-old female, with no other information, quite literally anything could be happening. Has she fallen? Is she on the floor? Is she having a heart attack? Is she having a stroke? I'm not really sure what I'm walking into here. Have your wits about you and deal with what you get when you get there.
Okie dokie.
Hello, Margaret. So, my name is Sam. We've got lovely Chris as well. What's going on? Have you had a fall, or are you?
No, I mean I'm active usually.
Yeah.
But I got up and I'm just off balance.
Okay.
I think she's a bit more coherent now than she was first thing.
When 92-year-old Margaret felt dizzy, she rang her son David. Her confused state of mind prompted him to ring 999.
So you felt all wobbly and not very coordinated?
Myself, I feel all right. I've got a pacemaker.
Okay.
I mean, to get a glass of water, you know, you've got to struggle anyway.
Were your hands working all right, Margaret, when you were making your...
I can't do the splits, but then I
Well,
couldn't
okay.
do those
I
when
couldn't do the splits either.
I couldn't do those when I was young, so I can't do them now at 92.
when somebody phones 999, for them it's quite a big deal. It can be quite nerve-wracking as well. So the jokey side of it, that could be masking people being a little bit apprehensive. So I like to see people laughing and joking, but I am aware that it can be hiding the fact that they're quite nervous. Let's have a look at you then, Margaret.
As Margaret says she felt a bit dizzy, Chris and Sam check her blood pressure.
Do you monitor your blood pressure? So does the GP make you...
No, I don't, because the minute you measure the blood pressure, it goes through the sky.
OK.
231/90. Do you take blood pressure tablets, Margaret?
Of course I do.
A normal blood pressure is about 120. At 231, Margaret's is almost double what it should be.
What I'm doing here, Margaret, I'm going to have a look at your heart, because you've got an irregular heartbeat, haven't you?
Yeah.
Yeah. And how long you had the pacemaker?
4 years.
Margaret's blood pressure was sky high. And despite Margaret being known to have high blood pressure anyway, a blood pressure of this high still puts her at increased risk of strokes, of intracranial bleeds. So it's something that we really need to get on top of quickly. Can you hold on to my hands for me? And can you grip my hands as hard as you possibly can? Brilliant.
High blood pressure and dizziness can point to a stroke. Sam carries out the FAST test, a number of tasks that check for any stroke-like symptoms.
I'm going to place my hands on your legs, lift up your legs, pull up, as in push against my hands. Brilliant. And with the other one? Brilliant. And give me a big smile. Proper, like, toothy grin smile. Brilliant. Happy days. Do you feel lightheaded?
Yeah, I
A
feel
little bit.
unstable.
OK. I'd like to get you up and we have a little bit of a wander to make sure that that's OK. Does that sound like a plan?
Right, all right.
Margaret doesn't appear to have had a stroke, but as she feels unsteady on her feet, Sam wants to check her mobility.
Could I see you have a little walk? So can you chase me around your living room? If you can just follow me.
You feel a bit wobbly.
Unstable.
And that's not normal.
No.
No.
OK.
Her mobility was not as good as it normally would be. Now, this is a little bit worrying because it can be indicative of some kind of problem on the brain, maybe a bleed or a clot. Now, we have done a FAST test for Margaret and it was completely normal, but that doesn't mean that something else could be happening within her brain.
How long's the sweating been for, the same amount as 6 days?
To the north of Birmingham in Sutton Coldfield, student paramedic Chloe and paramedic James are with John. He's sweating and has chest pains, both possible signs of a heart attack.
What we're going to do for you, we'll give you aspirin and then we'll give you a spray of GTN as well. See if that eases the pain.
Here you are, bud. Let me know when that aspirin's done and we can try a spray of this.
The aspirin will help prevent clots forming, while the spray will widen John's blood vessels.
You ready for this then?
You know what to do.
Lift your tongue, lovely.
All your numbers are good, but ultimately I would like to pop you up to hospital just to get it investigated. Just want to make sure there's nothing going on with your heart. Would you be happy to do that with us today?
It was really important that John came to hospital with us as we could not find the cause for the chest pain. I was really worried if John was having a heart attack or not because of the symptoms he was displaying, such as the sweatiness, the clamminess, dizziness. They're all massive red flags for heart attacks.
Your numbers are okay, pretty consistent.
Which is good, isn't it?
Yeah, it's always good. There wasn't a drop in your blood pressure when we've stood up. Judging by all the bumps in the road, we're probably around the corner from the hospital.
After a 2-mile drive, Chloe and James arrive at Good Hope Hospital in Sutton Coldfield.
You all right, John? How are we feeling now, bud? Not too bad. Yeah? Lovely.
Hey up, John, I got you a wheelchair, mate. Try and get yourself comfy.
Bring you around and we'll get you in, eh?
Here we go.
Here, John will have blood tests. This is the only way to know for sure if he's had a heart attack today.
Okay, good.
In Warwick, paramedic Chris and student paramedic Sam are with Margaret. As she's unsteady on her feet, they're concerned she may have a bleed on the brain.
What we're going to do, Margaret, we're going to phone the people at Coventry Hospital, tell them that you feel a little bit wobbly and you don't normally be wobbly, and we'll get a bit of advice. Is that all right with you?
Yes, all right.
And in the meantime, you can drink your tea.
Hello, can I run a patient past you, please? She's had a period of confusion during the night and she's quite unsteady on her feet. She is fast negative. However, we have a blood pressure of 231 over 91. So we're just querying whether it could be maybe a bleed, maybe a small bleed. Cheers, bye-bye. So, Margaret, I've had a chat with the stroke nurse. She advises that we pop you up to Warwick Hospital and get you checked. If Margaret was having a brain bleed, this is a life-threatening emergency. Every second that the brain is bleeding and the oxygen is stopped can cause permanent brain damage, so we need to get her seen as soon as possible. You okay?
Okay.
Would you like to take my arm or hold on?
Now you just like parading these ladies, don't you? Get on.
Come on.
Okay.
You sure you don't want to take my hand?
No.
As Margaret is determined to walk to the ambulance herself, Sam keeps a close eye on her.
All right, Margaret.
She's not letting me take her hand. I've been trying,
No,
but
he's trying to get off with the old gal.
He doesn't.
Oh, you know.
There we go, come on.
Who wouldn't, Margaret, hey? I thought Margaret was a great character. I thought she was a little bit flirty with you at times, Sam, do you think?
I don't blush very often, but I think she made me blush a couple of times. She was just a great patient, wasn't she? Just absolutely brilliant.
She was.
Right, Chris, I'm ready when you are. Happy? When did you get your pacemaker?
4 years. And last time I had to go, check it every so often.
Yeah.
And he said, I've got another 10 years.
I tell you what, you never know. 101? You reckon you can make it?
After 5 miles, Chris, Sam and Margaret arrive at Warwick Hospital.
Stand clear.
Right.
Ramp is in operation.
When you're ready, would you like a hand up?
Yes, right.
There we go. There we
Okay.
go. Right. Are you sure you don't want my arm?
He's here again.
I know.
Does he get off with any of these old gals?
Here, Margaret will be given a CT scan to check if she's had a bleed on the brain. Doctors will also investigate why her blood pressure is so high.
Other than the blood pressure and wobbly on her feet, I was a bit like she seemed fine.
I do think when she was walking,
Oh, she was
that
probably
she was quite, for somebody that can walk normally without a frame, she was really quite off kilter, I felt.
If you had a baby, what would you call them? I've got a list of baby names in my phone. Okay. I've got a list of baby names. But let's just clarify, at the top of that list of baby names, there's a list of dog names that I'd have. And obviously that's priority.
I have a fur baby. Yes, you do. He's called Albie, and he's a little Cocker Spaniel. And he's one, but I still call him a baby. He's still my little baby.
Cutie.
Yeah.
I quite like the name Boots for a dog. Boots and socks I like. Poncho. Poncho, that's quite cute. Yeah.
Ambulance service, patient breathing? Yeah, she's breathing. She's an 8-week-old baby. I was in the hospital last night with her because she's got bronchitis, but she's struggling to breathe.
Is she fighting for breath?
Yeah, she's bleeding around the lip.
We are going to little Luna May, who is 2 months old. Quite a pretty name, that. It is, isn't it? She's got some difficulty in breathing. It says here that she's got bronchitis. She's got blue around her lips. A baby who is blue around the lips could indicate that they were not getting enough oxygen into their systems, and if that happens, it can be fatal. It's going to be this one here, where the dude's just come out. Chap waving. Hello. Where are we going? Hello. What's this little one's name? Luna May. Luna May. What a beautiful name. My name's Sean. This is Ellie. What's been going on with Luna May?
I took her to the George Eliot. Yeah. Last night, early this morning. They said she's got, is it bronchitis?
Yeah.
Whatever one is called.
Yeah.
And then to use suction on her nose and saline spray, which I've been using, and then she just went really funny, couldn't breathe, lips went blue.
You panicked. Yeah, naturally.
Last night in A&E, Luna May was diagnosed with a chest infection. But today, when her symptoms worsened, Mum Hayley and Dad David rang 999.
We'll get our SATS probe on and we'll see what our oxygen levels are doing, if that's all right. Any problems other than the bronchiolitis that she's been going through at the moment? No. Everything normal with birth?
She's good inside.
Okay. Mum informed us that Luna May had had a bowel motion while she was still in the womb. This could increase chances of infection in a child, and it can set massive alarm bells ringing. Chest sounds a bit rough, but I expect that with the bronchiolitis.
Oh, I know, sweetheart. Your ears are so small.
Ellie checks Luna May's oxygen levels and her temperature for signs of an infection.
First one was 36.3, so Hello. Has she been feeding at all?
She's been drinking like an ounce. Normally she has 4-ounce bottles. They said that she should be drinking at least half of them, but yeah.
Oh, you're just feeling rotten, aren't you?
As Luna May's been feeding less than normal, Ellie needs to test her blood sugars.
It's going to hurt you now.
Lovely. 3.9. Ready for a feed then? Yeah.
Luna May's blood sugars are slightly low, which suggests she needs a feed.
Oh, bless her. So, bit of reassurance, her oxygen saturations are 98 and they've gone up to 100 as well. Okay, so she is getting the oxygen that she needs. Obviously, her chest just is really congested at the moment. Okay. We'll let her feed and then we'll pop her down the hospital, all right.
Although Luna May's oxygen levels are good, her congested chest needs to be examined by a doctor.
Lovely. And then we can get some snuggly blankets for her. She doesn't have one. Oh, that little lip tremble.
With Mum and baby on board, Ellie can set off for hospital.
It's a huge responsibility for any ambulance crew going to a baby, particularly because you've not only got the baby to look after, but you've also got the parents that are looking upon you to help them.
After a journey of 10 miles, Mum Hayley and baby Luna May arrive at University Hospital, Coventry.
Right then, beautiful. Should we get you in? See a little cutie pie.
Here, doctors will investigate if Luna May still has a chest infection. They'll also want to check if she's getting enough oxygen.
Oh my goodness, wasn't she just adorable?
She's had a bit of a traumatic start to life.
Yeah.
Having problems with the lungs and whatnot, and now the bronchiolitis. And she's got it all going on. She has, bless her.
What would your last meal be on death row?
Chinese.
Would it?
Yeah.
I think it'd have to be at McDonald's, mate.
Yeah, or Mackey's or KFC.
I don't think anyone on death row would ask ever for a salad, would they?
No, although I do like a salad when they're made by other people rather than myself.
Yeah.
I feel like
do
it's a
like
bit
salad,
more of a surprise.
But it's too healthy. If you're gonna die, you want to go out just eating
Yeah.
anything and everything that you
Tastes nice.
love. Yeah.
I like the salmon in pastry, salmon on
Oh, we
croûte.
had that on Saturday.
Did you? I love it.
Yeah, we had salmon on croûte.
I should probably just make my own, but I can't be bothered.
Ambulance services, the patient breathing?
Yep. I'm one of the district nurses. I've just come out to see a patient and I'm concerned she's got a blood clot in her lower leg.
And how old is she?
She's 102.
We have got, Winifred. She's 102.
Oh.
And it says query DVT.
I think that might be the oldest patient I've been to.
Wow. Yeah, maybe as well. Keen to avoid hospital admission. Please treat symptomatically.
A blood clot in a vein is called a DVT, and it can be life-threatening.
We don't go to many 102-year-olds, do we?
No, we don't really, do we?
No. So especially with her having a DVT and being at that age, this could be fatal.
Across the West Midlands, we're on board with 7 paramedic crews simultaneously as they work a typical 12-hour day shift.
So it looks like right here.
In Coventry, paramedics Jess and Sarah have just arrived at the home of a 102-year-old patient who has a possible blood clot.
What's your name? Winifred. I'm Jess and this is Sarah. So how can we help? What's happened?
I don't know, in a bit of a mess.
When the pain in Winnie's leg got steadily worse, District Nurse Brooke rang 999. Daughter Jenny is also here.
She was on warfarin, but they've suspended all of her medications.
Okay.
I don't know what reason for.
I think it's because of the continuous fall she was having.
Right,
She was safer
okay.
off it.
Yeah.
She's had some problems with her right lower leg for about a week. So
Yeah.
we've been coming in to apply the compression hosiery, but she's been having increased pain and wasn't tolerating the compression.
Okay.
I'm just worried she's got a DVT in her lower leg, really.
Okay. Has she got a respect form?
Yes.
Yeah.
And it does say no admission.
So not for hospital
Yeah.
admission or active intervention.
A respect form basically has people's wishes when they're able to make that decision before they get too poorly, and it just states what they want to happen when it's nearer the end of life.
And Winnie's was not to attend hospital and to avoid it if possible. Bless her.
Getting all worked up.
Oh, you don't need to get worked up, darling.
I haven't slept nearly for a whole week.
Is that because of your leg? Because it was
Yes, my leg.
uncomfortable, yeah.
Can I have a feel of your leg? Is it painful here?
The back of the car.
There. And how long's it been like that for? Just relax your leg down.
All this last week.
Winnie seemed quite nervous and anxious about us all being there. She'd had this pain in her leg for a while and so was having difficulty sleeping, so she was also quite exhausted. So how are you feeling?
Awful.
Awful. What are you worrying about?
Going into
going in?
I don't want to
I
go.
know.
Every time I've gone in for something simple, I've had something not so
I
simple.
know, I know.
And I'm just scared.
The thing is, Winnie, right, we can explain the risks to you. We can't force you to go to hospital, okay?
We can only tell you that obviously if this is a blood clot in your leg, then it can travel and it can go elsewhere and cause further issues. But ultimately, if you do not want to go, we can't force you.
It would just be a blood test and then an ultrasound on your leg.
Then if everything's okay, then you can come back out.
If it is a clot, it could travel into different parts of the body, like your lungs, and unfortunately be fatal for her. And without going to hospital and getting a blood test, we can't tell if it's going to happen or not.
You're at risk of strokes and heart attacks if you left a blood clot. She didn't want to attend hospital, so we did have to have that discussion on scene with her. Are you going to come with us, Winnie? Yeah, I know you don't want to.
Stupid. Lay here thinking about
Well, it'll be a bit of a risk staying here, to be honest, just until we know. But it might be that you haven't got one, and then they'll, you know, you can come
back home.
straight back out.
They can't make you stay.
Yeah.
All right.
We were really relieved when Winnie decided that she would come to hospital with us, because we knew that if she stayed at home, it could become life-threatening. Winnie, we've got a chair behind you.
Yeah.
There we go.
The chair down.
There we go. No arms. Bit.
Happy to go all the way.
Right then, one more move, Winnie, just onto this bed suite, all right? Ready? 1, 2, 3. All right?
With Winnie and Jenny on board, Sarah and Jess can head to the hospital.
I'm ready whenever, Sarah. Okay. Do you get a bit frustrated you're not able to do?
I feel it.
Yeah.
Because I'm stubborn and independent.
You should admit to it. Winnie was great for 102, and I just hope that I'm that independent when I get to her age, if I get to her age. She was a right character.
After 20 minutes, Winnie arrives at University Hospital Coventry.
We're here now, Winnie. Well, hopefully we won't be here long. Let's get it done, and then you can go home and then not worry.
Here, Winnie will have blood tests and an ultrasound to see if she does have a blood clot in her leg.
Well, I think that was the oldest patient I've ever been to.
Oh, Winnie. Amazing.
102. Yeah, it's nice she's in her own home.
Yeah.
And still independent.
Yeah, and
Probably what's
walking at
keeping
least.
her going.
Yeah. She was brilliant.
It takes a special type of person to answer 999 calls. Not everyone can do it.
And she's got an abdominal wound.
All right, just stay nice and calm.
I'm going to stay on the line with you and tell you exactly what you need to do.
And increasingly, the ambulance service is acting as a safety net for those struggling to cope.
They're calling you at one of the most distressing times, probably, of their life. And it just makes you feel like you're giving more help if you're making them feel comfortable on the other end of the phone. Ambulance service, is the patient breathing?
Yeah, I'm breathing now, but in 45 minutes' time I won't be breathing.
Are you the patient?
I'm going to kill myself.
So I just need to know firstly, have you lost any blood from anywhere at all?
Partly from a neck wound where I tried to self-inflict an injury.
Right, okay, was that today?
In the last 20 minutes.
It is scary because you know how awful neck injuries can be in any way, and blood loss, and he was on his own, so you think all the worst things. And at the moment, that blood from your neck, is it spraying or spurting out of the wound?
No, it's really slow flowing, but it's going to be like potentially fatal.
Right.
I don't get medical assistance.
Okay, have you covered it with a dressing? Have you put anything on it to apply pressure?
No, because I want to kill myself. Do you hate me?
Of course I don't hate you. No, of course not. I want you to stem the bleeding. That's why I'm asking if you've got a dressing on it, because I want to help you. Can you put something on that bleeding to try and stop it for me?
No, because I want to bleed out when I die. I'm feeling really weak and I want to go to sleep.
Well, I don't want you to go to sleep. You just keep talking to me.
I guess I got probably 25 minutes left to live, if I give you a rough estimate.
I don't want you to think like that. Don't think like that. We need to try and get you help. When he passed me that time frame, I have to kind of just let it go over my head, because if I don't, and if I pay too much attention to it, I will just overthink the whole situation, and I will just be watching the clock.
Neil, you are as a CAD operator on a computer terminal and just doing your daily job, which you do every fucking day, and you must hear horrific things every single minute of your job.
Of course, but I wouldn't do this job if I didn't care, did I? And I do care.
Do you honestly 100% mean that, or are you lying to me?
No, I 100% mean that. I wouldn't lie to you, would I?
No, you wouldn't lie to me.
No.
You sound like a really nice person.
Well, we're just trying to get everyone the help that they need, but we haven't got any ambulances available at the moment, and it could be a long time before we do. Is there no way of you getting to the...
I'm going to kill myself. So you got exactly now, this 30 minutes now to get an ambulance here, or I'm going to die.
I don't want that to happen. Telling any patient that we have no ambulances is not nice, but when it's a patient who is as distressed as this patient and was struggling on the phone as much as he was, it's even harder, because you'd wish that there would be someone who you could just send, but it's not always the case, and it's hard. It's out of my control. If I could get someone to you quicker, then I would, but it's out of my control.
OK, just cancel it. Cancel it now.
Despite his protests, an ambulance was sent to treat this patient, and he was taken to hospital.
Mental health is massive. They're so difficult because you can't put yourself in that person's head. If someone's got a broken leg, you can kind of imagine how they're feeling, but with someone with mental health, you can't put yourself in their shoes. It's not that easy.
In Birmingham, Chloe and James are nearing the end of their 12-hour shift.
Oh, but I realised I just had my fizzy drink on break. I didn't have my coffee. At least I'll sleep tonight. That was always a good one. No, I've got to stay up. I've got to watch TV at 10.
I'm going to tidy my room, go gym, do work.
Chloe's got endless energy. I come the end of a shift, I'm ready for bed.
But half the time I've got like football or something after.
Yeah, I always start the shift saying, oh, I'll go for a run after work, but then...
It never happened.
Come the end of the shift, I get home, I make my dinner, sit on the sofa, and I went, no, I'm comfy now.
I used to do exercise before I did work. I felt like it just energised me to get my work done, like motivates you to get your work done.
You've been to the gym, like...
You've already done something, one productive thing.
Ambulance service, is the patient breathing?
Yeah, she's breathing, but she's just passed out.
Is the patient conscious and awake at the moment?
Mum. Yeah, she is.
Okay, lovely. How old are you?
I'm 11.
You're 11. Okay, is she fully awake?
I can't tell. She's just staring off into space.
35-year-old female drifting in and out of consciousness. Patient's now awake, but it looks like the call has come from a child.
Oh, but imagine like finding your mum. It's really unusual for kids to call for their parents when they're unconscious, especially to call 999. It's difficult for them, depending on their age, and it can be quite traumatic as well.
Yeah, because we need to know what's caused it. It could be something like a faint, or it could be something sinister like cardiac arrest, so it's really important we get there as soon as we can.
Yeah. I bet the kid's really upset.
In Birmingham, Chloe and James have arrived at the house where a child has called 999.
Are we here for your mum? Yeah, can I have a little chat with your mum? What's happened, sweet?
It was a collapse. It's a bit embarrassing.
It's fine, what's happened?
Basically, I was constipated.
Oh, OK.
So
And we feel like you strained a bit too much.
And I've bled from my front to my back. And
Okay.
as I've got up, I've collapsed.
When 35-year-old Gemma passed out on the floor, 11-year-old son Caden rang 999. Younger brother Ethan is also here.
If you have torn, you'd need it sutured and looked at by a doctor or a gynaecologist, really, just to make sure the tear's not significant.
Okay.
It's up to you whether you want to come with us.
It's childcare
Or
for a little one,
if you-
because their dad's not home till about 6, half 6. Still feel a bit unsteady on my feet when I stand up. And obviously I'm in a lot of pain as well.
Where's the pain, sweet? Is it in your tummy?
Yeah, it's like back passage as well.
Okay.
I think she was a bit embarrassed, especially because we had her kids around as well. But I think we made her feel quite at ease and calm.
It's probably not a regular occurrence for her to lose consciousness and have her child call an ambulance. So I think it was a whole new experience for her.
Well, you all did all the right things, so well done. You're 7, you're 11, and you rang the ambulance on your own.
Well done, bud.
I know. I don't think I could have done that at 11. Caden really impressed us at the fact that he was able to call an ambulance for his mum. It's important to know your address as a kid so you're able to understand how to call for an emergency services if you need one. I'm just going to take a small spot of blood from your finger, all right, sweet? Just check your sugars.
What's a little bit more blood coming out?
Sharp scratch.
I like that. Oh.
You bleed well, don't you? Give that a squeeze for us.
Thank you. Thank you.
6.2, lovely. Right, so I'm just going to do your blood pressure again, okay?
Fine.
It's perfect at the moment anyway. All your
I
numbers.
feel completely normal. This is why I didn't think I needed an ambulance.
Better to be checked over though.
Out of 10, sweet, what would you score that pain at the moment?
Probably about a 6, but there's nothing that paracetamol can't do.
The lady after my own heart. Anything wrong? Bit of paracetamol does the trick.
Are they parrots?
Yeah. She's got a farm out of that one out.
Really?
I'm hoping that she doesn't smell.
She's got a very busy house.
I do try and leave her and rescue them.
Having a conversation with a bird, it's actually talking to them.
Just don't put your phone on the arm of the chair because he puts his foot out.
And he's actually grabbed him.
Right.
Oh, good.
Someone's not happy.
I love animals, so as soon as I see someone with lots of animals in the house, I immediately think you're clearly a nice person because you clearly care a lot about things.
All right, just have a little feel of your tummy. Yeah. Just have a little listen first, make sure everything's rumbling and grumbling as it should. Does that not hurt?
This?
Yeah, so not get caught.
Oh my God, if I did that, I'd be crying. Gemma pulling on her belly button piercing, it literally sent shivers all over my body. Even as a student paramedic, things like that, like piercings and the way people can play with them, it freaks me out.
Just let me know where it's most uncomfortable, okay?
A bit there in the centre.
Yeah. There. So mostly in the middle, isn't it? Right, then, sweet. If you're going to wait, you're going to have a chat with
Yeah,
your
it's just a childcare what's the issue.
Yeah, no, that's understandable. That's fine. I was going to say I won't cut you away.
Gemma didn't need to go to hospital. All her obs were fine, and she had childcare issues as well, which would have made it difficult for her to get to hospital and stay at hospital. So we were happy that this could be easily managed by a call to the GP.
Right, I'll write you a little letter, just to say what's happened, all right, sweet.
Thank you.
It's all right, you did the right thing, bud.
Good lad, ain't ya?
If it happens again, just do exactly what you've done again.
Okay.
But it's better to make sure she's okay and in one piece.
Well, Mum, remember once when we was on the high street, you said if you ever pass out, call 999.
Yeah, I always teach him if anything ever happens around him.
No, it's good, we're with
What to do, basically.
I think all parents should teach their children to ring 999 in a medical emergency because you never know when you're going to need it. It might not just be a case of they might use it when they're at home, they might use it when they're out and about with friends. And so it's a really important life skill to have. Leave that with you,
so much.
and we'll get out your hair.
Okay.
All right.
Right, you two.
Right.
See you later. Bye. Oh.
Bless him.
Bless him. Oh, that job was like...
It was the best end to a shift ever.
She got
And
two good boys though, ain't she?
Oh yeah, absolutely amazing.
102-year-old Winnie didn't have a blood clot in her leg. The pain was caused by a bacterial skin infection called cellulitis. She was back home the same day. John, who had throat and chest pain, had blood tests in hospital. These confirmed he wasn't having a heart attack. But doctors were unable to identify the cause of his pain, and after 12 hours, he was allowed to go home. Baby Luna May, who was struggling to breathe, was still suffering from the effects of a chest infection. She went home the same day with instructions to increase her fluid intake. And Margaret, who had very high blood pressure, was given a CT scan. This showed she hadn't had a stroke. After being given medication to bring down her blood pressure, she was allowed to go home. Next time.
Right, stay where you are, mate. You're not moving.
A man is struggling to breathe.
If the patient is not getting enough oxygen into his body, obviously this can cause the organs to shut down.
A slipped disc leaves a woman in agony.
The extrication was going to be difficult as her back was constantly in spasm, so we needed to manage her pain before we moved her.
Will you let me know if you've got any pain, okay?
Ow! And a patient with a potentially life-threatening infection.
He was now ticking what we call red flag sepsis, which can be very dangerous. It can lead to multi-organ failure, and you just need treatment very quickly as it can be fatal.